As a sufferer of endometriosis, it is a tremendous disease. It takes over your body, it takes over your mind, and you deal with pain. You deal with pain on several occasions during your month. It is incredible. I'm one of the lucky ones. I know what's wrong with me. But there are thousands out there at the minute who do not know. They are told by their doctors that this is a normal pain. It's not normal. You're told to, as Senator Chambers said, buck up, get on with it. This is part of being a woman. Pain is not part of being a woman. And although we, time and time again, being a woman in this country, I think pain is synonymous with it. We have seen the bruises and the suffering because of that. But the waiting lists, Minister, at the minute are incredible for gynaecological outpatients. Over 30,000 women are waiting for treatment at the minute, for a doctor's appointment. That is absolutely horrendous. And when you think 1 in 10 women have endometriosis, how many of those people women who are waiting for an outpatient's appointment and who have endometriosis and are not getting treatment? We need really quick action on getting those ambulatory clinical services open sooner rather than later, because it really is. It's about the quality of life for young women and girls, because they are suffering. They don't know what is wrong with them. They're told that it's in their head. And please, Minister, bring that back to Minister Donnelly, because action needs to be taken. Thank you.
Thank you, Chair. Can I thank both Senators Chambers and McGreehan for bringing this to the floor of the Seanad this morning and giving me an opportunity to address it. But my speech is actually Minister Donnelly's, but both of us are acutely aware that you've been long advocates on this issue for it. And I want to begin by emphasising that the Government is committed to promoting and improving women's health outcomes, and the commitment is spelled out very clearly in the programme for government and has been underpinned by provision of 12 million in the budget of 2021 for the new developments in maternity and gynaecology services. In terms of treatment of endometriosis, currently, as Senator Chambers has said, it's a GP referral to a gynaecologist is the standard pathway of care for the management of this condition, and this is similar to the pathway in place for the management of other gynaecological conditions. I am advised that all obstetrician and gynaecologists are trained in the diagnosis and treatment of the endometriosis. The HSE National Women and Infants Health Programme has advised that the best way to help the majority of patients with endometriosis is to improve access to gynaecology services generally, and I think we would all agree on that. And the programme has developed a plan to increase capacity and reduce waiting times for women for gynaecology appointments. The plan aims to reorient general gynaecology services to an ambulatory or see and treat model rather than the traditional outpatients referral model. The new model of care involves the establishment of a one-stop ambulatory gynaecological clinics. These clinics will help to ensure that gynaecology patients receive safe and appropriate treatment, reduce the need for multiple appointments, ensure a more effective use of public funds, and ultimately improve clinical outcomes. The rollout phase 1 of the new model of care commenced last year, and I'm delighted to confirm that the ambulatory gynaecology clinics in Cork and Galway are now providing services. While it is anticipated that the clinics in both Rotunda and Waterford will be operational this year. And it's important also to say I'm mentioning 4 hospitals, but at the same time, that's not near enough by any manner or means. And with the new funding provided in Budget 21, the rollout of the model of care will be accelerated, and additional ambulatory gynaecology clinics will be established this year. And I should also mention that last year the Women's Health Task Force identified a number of priority areas for action. In that context, the next to improve services for women with endometriosis was recognised and included as part of a priority work stream to improve gynaecological health for women and girls. The endometriosis workstream identified a number of potential actions in this area, including enhanced services and supports and the potential establishment of a centre of excellence for endometriosis surgery. Budget Budget 2021 has also provided a dedicated €5 million health fund to progress a programme of actions arising from the work of the Health Task Force. The Department of Health has engaged with the HSE to identify proposals which could be implemented in 2021 and funded through the Women's Health Fund. A number of proposals are currently being finalised with stakeholders, and it is anticipated that announcements will be made in the coming weeks in relation to the actions which will be supported by the fund. And I believe that developments I have outlined underscore this government's commitment to improve services for endometriosis, gynaecology and more broadly. But as you say, Senator Chambers, 1 in 10 is the figure, 30,000 on a waiting list, 2 hospitals providing the service, 2 more to come on stream in 2021 is not clearly well enough, and actually it is about education and giving support to our GPs as well, and get rid of this idea that it is in your head. There is an issue there. We need to be able to call it out exactly what it is and give people back their lives.
You to bring back to the Minister for Health that for the Rotunda Hospital, that the 2.5 million for the critical care unit for the Rotunda, the world's oldest maternity hospital, that's all that needed to move forward to the next stage to get their standard of care up to a modern standard. There's 3,000 people waiting on the waiting list in the Rotunda for care at the minute, and I would ask the Minister to move on the Rotunda Hospital's critical care unit. Thank you.
Thank you again, both Senators. Yes, I will bring everything you have said this morning back to Minister Donnelly. Yes, the Women's Task Force are meeting later on this week. And yes, I will be 100% supportive of it. I think for far too long, young ladies didn't really know what they were presenting with. They thought this was normal. And this is far from normal. And Senator Chambers, I think there is no man in this country that would accept this. At any stage for the ladies, and it's mainly ladies that's actually present here in the chamber on this conversation on International Women's Day. There is no way that a man would put up with what you have described here this morning. Like, we all know what a bad period pain is like, and it goes with 2 Panadols, you would hope. But for it to continue without a diagnosis, and that to be a reoccurrence every single month, and other pains that you would actually doubt, it's inhabilitating for a person, and we have to stop that. We have to give women back their lives, and the only way we can do this is by having a proper ambulatory service right throughout the country, not just in 4 hospitals, not just geographically. We have to look at everybody and give, and also education for our GPs, so as that these young people, when they go back and they talk to their mums as to what the GP has said, it was all in their head. We now need to stop that. Thank you very much.